Okay, so we'll work on, we'll talk about Unit 4, LO5, working in health and social care. So we'll understand the principles of care planning. We've talked about how to work in partners and what partnership is, what's the significance of working in partners, and how do the different partners work within the healthcare system. And yeah, that was our main discussion last weekend. So the principles of care planning, a bit about what we'll cover in this. So individuals, when have their plans, you have documents that show their preferences and their requirements if you've taken it as a patient-centered care, and support, negotiation, consultation in empowering the individuals. They make their decisions and choices in order to document the individual needs. You evaluate plans to assess effectiveness of meeting individual needs. It's a holistic approach to meeting the needs and preferences of individuals. You have team members and colleagues, you have different advocates, and you have other professionals. The individual requiring care and support, you have families, their friends, other people who are very important to that individual. Then you have other care planning principles. These include the individuals being in all planning and reviewing, and you're not talking over them or about them. You're behaving positively, ethically, looking at what they can do instead of what they cannot do. So we're talking more about positives instead of negatives. This is what, sorry, for all, everyone who we're dealing with. Then we're using effective communication. We are accessing resources, consultating or having consultations. Can I request you to please mute yourself, please? Yeah, thank you. Inclusive communication. So what does inclusive communication mean? Can anyone tell me about it? Inclusive communication. Anyone?
Inclusive communication.
Conversations with the family of the patient, giving the patient more information about their own care, letting them make the decisions.
Very good. Thank you, Farah. Who wants to share some more?
It's just an communication, a kind of communication whereby all the parties are effectively understand the word of communication.
Yes. So it's including the people that you're caring for. It's including them in that communication or in that care process, whatever communication you're having. It's inclusivity. You're respecting individuals' choices. Thank you for your responses. Thank you. Listening and responding to questions and their concerns. So they can have several concerns. Different people have different concerns. You're responding to their questions and queries. You're working to resolve conflicts. There could be conflicts also. There could be something that you are advising and they do not agree with, or they want something else. So you're working towards resolving those conflicts. This all is a part of care planning. Seeking extra support and advice wherever it's necessary, and then you could have specialist support, which we all rely on, isn't it? So whenever we talk about different situations, when they are distressing or traumatic, they can be potentially harmful or unsafe. and you could likely have serious implications, consequences. This involves confidential information involving complex communication, supporting cognitive needs, etc. So we'll talk a bit about all of these. So what's care planning? So it's the conversion between the person and the healthcare practitioner about the impact their condition has had on their own life. So obviously, planning, you're including those people who are part of the plan, and those are your patients, and how they can be supported to best meet their health and well-being needs in a whole life way. So they're different people with different needs and requirements. The care plan is owned by the individual. The individual themselves are responsible for that care plan, and they're shared with others with their consent, only with their consent. It is important that this discussion takes place, this inclusive discussion takes place. There is a record of it, and people know that they have a plan, so that they know that their health is in their hands. So we are talking about Dylan, who has a personal wheelchair story to share. I'll just share it with you. I'll stop sharing this. I'll start sharing this. Just let me know when my video, my audio can be heard, because I had a bit of problem with it. Yeah. So this is a story about Dylan, and it's basically talking about his requirements. Can you hear it? Can anyone let me know if I'm turning it on? Can anyone hear the sound of the
No.
video?
No, I can't hear it.
Can't hear it.
Just a minute. Just give me a minute. No?
No, we can't hear it.
Uh,
Okay.
just a minute. Switch to phone test. I have no idea. So no. I'll just give me a minute. Okay, now can you hear it? No?
No, I can't hear it.
Let me have a look at it. Why is this giving me trouble? Because it's never given me trouble. Okay, so if you can't hear it, what I'll do, I'm sorry for this. I'll share this link with you, and once you've had a look at Dylan's story, just let me know.
Okay.
Yeah.
Okay.
So I'm just sharing this link with you. Please have a look at this, and once you've done, please let me know. I'll just put myself on mute, and I'll keep trying this audio. Yeah, I'll then see you in whenever you're done. Just message me in the chat that you're done.
leaving on September the 9th, in fact, and I'm going to do computer forensics, which will hopefully allow me to give something back to the community and to say thank you for everyone who helped me get this.
This is the first time I've actually seen the process to go from start to finish, and it's been an amazing experience for me, and it's quite emotional really, because I didn't realise what a huge impact it could have on somebody's life and the opportunities that we can now provide to them.
Okay, so I get it that some of you have seen the video. That's brilliant. If you haven't had a look at it, please do when you're free. So I'll start sharing my screen again. We'll go back to the presentation. So then had a wheelchair. He had mobility needs here, and yeah. So what was done then? His requirement was taken into consideration. He had different healthcare needs. He had travel and movement needs, which were assessed, and then he was provided with it. And his main objective was, because of his, obviously, he's a different person. A different person can have different needs, different requirements. So his requirement was studying and socializing. So this was the requirement that was fulfilled by keeping him at the center of all care. So what's the purpose of care planning? So care planning is a conversation, an inclusive conversation between the person and the healthcare practitioner. This is about the impact that condition has had on their lives and how they can be supported to best meet their health and well-being needs in a whole life way. So it's the whole life that you're considering here. The care plan, it's owned by the individual and shared with others with their consent, not without them. So the relationship between the person and the care professional should be having different components. So it's gathering information, identifying wishes, feelings, and goals, exploring different options for care needs, assessing the risks that are there, the benefits that are there, assessing them, also agreeing the plan, what will be provided and how would it be provided, and delivering the care and support plan in line with the person's wishes, and monitoring and reviewing. So you're not just giving the care as it's required, you're then monitoring and reviewing also. Can everyone hear me?
Clearly.
Yeah, I just was concerned. There was silence. Yeah. Any questions in between? Please let me know. Yeah, thank you. Care plans. So care plans are based on different individuals' needs, and they're different from person to person. So one person will have a different care plan compared to another person. It depends upon their age, their gender, their personal circumstances, religion, everything comes into play. So each care plan is unique. They all serve the same purpose, which it should be to ensure that the person receives the same care regardless of which care worker is on duty, ensuring that the care that the person receives is recorded at all times, and supporting that they identify and manage their own care needs. So in the case of Dylan, everything was recorded, and he got the same care regardless of who was there on duty, and he was there to manage his own care needs. So he could change them, he could make them flexible. So when they're flexible, these care plans, it means that when or if the care needs to change, the plan will be reviewed again and adjusted accordingly to make sure it meets the person's needs and their preferences. So their needs might change. They might not be comfortable with what they asked for. They could change their plans, but this would have to be reviewed and recorded again. So what does it include? So it's first of all, foremost, the The person should always be involved in the care and support planning, so the person shouldn't assume that they wouldn't have a say in their care plan, and it's only the doctors or the nurses or the care staff that's they're responsible for that. No, they should be made aware of their autonomy, and regardless of what their preferences are, their plan should include what they have accessed, their assessed care plan or care needs are, what type of support should they receive. So it could be support with such as mobility, like Dylan wanted it and received it. Their desired outcomes, he wanted to study and socialize. So what is your main outcome? And who should provide the care? This should be very clear cut there. When care and support should be provided, is there a waiting for that? If there is a waiting, why is it there? How long will it take? Records of care provided should be included. Their wishes and personal preferences should be there or at all times. The cost of the services, the resources that are there should be included. So the cost would also include manpower. It would also include the material that you're getting, all the money that's being spent on it. So if the local authority has found that you have that the person has a care and support need, and they will contribute towards the costs, the care plan should include their personal budget and how much they will pay towards the care plan or towards the care. So for the wheelchair, for instance, if they can afford that, that will be on them, on the person themselves. And this will be assessed again. If there's a person who cannot afford that, then there are other ways also. So depending upon what support is needed, the care plan should include everything from personal assistance, visiting each week, to home adaptations to make the person more independent. We'll talk about the Mental Capacity Act, MCA. So each person's needs and choices will be unique to everyone. There'll be different people. Again, as I said, different people have different needs. This means that the staff, they must do all they can to help the person in order to convey their personal aspirations and goals and the support that they need. So they should be open. There should be a transparent, inclusive communication about whatever plans are there and whatever the needs are. Creating the care plan with the person or their chosen representative will always keep in focus on what is important to that individual. This will enable their care and support to reflect this. Whenever you're designing a Mental Capacity Act compliant care and support plan, this requires a cultural shift. So you're moving from traditional models of care planning to person-centered care planning. So that, for instance, there's a person who has certain objections to a certain care that you provide to them to support their mental health. So you'll have to adapt according to their situation. So there's this table that shows key differences between traditional, what was there before, and person-centered care. So traditional care planning, initially, it had the professional, where the professional, it could be the healthcare provider that assessed the person's needs, whereas now care and support plans are actually developed hand in hand with that person who requires the care. And this is also considering the Mental Care Act compliant care planning. The conversation will be including the person who knows best about their needs and preferences. So, and this will be by consent of that person who needs the care. Traditionally, care planning followed a medical model of disability, so everything had to have a medical basis. But now there is a social model of disability also. So society also makes you disabled. So sometimes medically, everything cannot be explained. Sometimes there are certain, by social model of disability, I mean to say about the psychology, we take into consideration other points as well, not just the biology but behind disability. So it's considering, it's more holistic, it's considering more aspects that could be taken into consideration while providing care to that person. So there is a focus on what the person is unable to do. Initially, there was that, but now there is a focus on their goals and aspirations and what the person would like to achieve with their care and support. Initially, there was a static view of the person's ability or capability. Now, care planning explores potential for changes, opportunities to develop capacity and ability. Initially, the professional was the one again to write care plans. They had no say, the person who was taking the plan or anyone who was representing them. But now, with the person-centered and MCA-compliant care planning, the person is supported to express how they would like their care and support to be delivered. The professional provides information about what the service can offer, and they agree that what will be in the care plan and support plan. A copy of the plan is made available to the person or their representatives, whoever leads that care plan. The emphasis earlier was on protecting the person from risk. Now it is respecting the person's rights to take risks that they can understand and they can deal with those risks. So it's positive risk taking again. The process initially took place when it was convenient for the professional, but now it's talking about the convenience of that person who needs the care. Power was with the professionals earlier, but power is now equally shared between the professionals and the person who requires the care. So there are certain roles that we need to outline and responsibilities involved in care planning. So there's a multidisciplinary team that is involved. What it is in what does it comprise of? It comprises of doctors or medical providers, nurses, physical occupational speech therapists, then nutritionists, dietary consultants. Spiritual healers could also be a part of it, spiritual leaders, the patient and their family members. So it's all a multidisciplinary role that is there for the care plan to be taking place. The nurse aides role. So the team here, it shares its experience according to the patient's progress, and there's a nurse that encourages the patient to speak to the team regarding their observations and concerns. So this nurse, he or she shares information regarding the general status and the mood of the patient, difficulty with meals and bathing, concerns she has regarding the patient's safety. So this is a nurse aide's role that can also be there in place in order to improve care planning. It could be more, so this is not the only information that's there. So after a gap was found in patient safety and difficulty with eating his meals, the nutritionist plans to see if the patient for speech evaluation has a problem with swallowing. So the nurse explains that to ensure that the patient gets enough to eat and eat safely, the patient will be assigned to several new tasks, included in the patient's plan of care. As the nurse aide, he will ensure that the patient is out of bed, sitting upright during meals to prevent choking, assist the patient during meals by cutting large portions into smaller sizes and opening challenging containers, and monitoring completion of meals to document their nutritional intake. So this is something that you could look at while planning for someone's care. So what are the responsibilities of a care worker in a residential home? Can anyone talk about what your responsibilities are? Anyone working in a care home? Anyone who's ever worked in a care home? Anyone? Want to discuss anything about it?
Can you come again?
Yeah, so I'm asking, what are the responsibilities of care worker at a residential area or in a residential home? Anyone has the experience? Can you share that with me?
Okay. The responsibility of the care worker in care home is whereby as care worker need to reports reports whatever the information about the service user, do the abide by the rules and the policy of the home, do his work or his or her work diligently, and
Okay.
also communicate with both the family and the co-workers, like nurses and other staff.
Okay. Brilliant. Anyone else?
Okay. I think the question is responsibility of a care worker, right?
Yes.
The responsibility of care worker.
Okay, so I
In care
feel
home.
more of in addition to what the other person has said, care worker has responsibility to deliver care in a very diligent way. Also, because you have more contact with the service user, so you need to be able to pay attention to detail to the person you're taking care of. Probably there are sometimes maybe there is maybe changes in maybe the way the person is eating. You have to be able to document every change you noticed. Then also you have to be able to effectively communicate to your service user, your superiors, all observations and anything you notice.
Yeah, thank you.
You need to take into regard all safeguarding issues. Make sure you have all the safeguarding. There's 5, I think, points. You need to make sure you give the patient their dignity, respect when speaking to them, empowering their decisions. You also need to make sure that their fundamental rights are also included in all decisions.
Yeah, very good. So, yeah.
Also,
want to-
like you have to also be very careful in data protection, privacy.
In addition,
Like you have to do all these things at once.
Yeah. Yes. Yeah, I do. Thank you so much for your comments. Very well taken. So, yeah. So a care worker's responsibility, it involves physical care, support for the residents, whoever's living in that residential home, their emotional well-being, following safeguarding procedures. It includes fire safety. So their daily responsibilities could include, this is just an arbitrary list, there could be more, helping a care home resident get dressed, wash and eat, providing company. So you're chatting with them, sharing news with them, involvement with writing residents' care plans, providing information to family members regarding the care plan, ensuring that the residents' needs and wishes are met, working with other health and social care professionals to provide holistic care, recording and reporting essential information in the residents' daily reports accurately and immediately, administering medication under supervision, and then gently encouraging them to get involved in their recreational activities, which keeps them active mentally and physically, giving them feedback to the health and social care professionals. So these are the multitude of, or more than these also. So the care planning process, it has different phases. This is a model that I've shown you. It's like a wheel, in which phase 1, you identify certain aspects of care. Phase 2, you prepare for making the plan. Phase 3, you plan with the patient. And in phase 4, you manage the care plan. that has been made in collaboration with the patient themselves. So sometimes you would need this, I'll just start this annotation. Yeah, so sometimes you'll need these process steps. This gives a good, this is a good chart to follow. So to see the identity of the patient for care planning, and control, contact the patient to offer care planning appointments. So who could benefit from this? And sometimes it is someone who is not a new person, and it's a person who has recurrent requirements. So that's the same person. Who could be there? What could your care plan do? Has there been any interest or experience or availability? So there's who's responsible for this, and who's then taking care of the next of all the requirements. And then you prepare. So the next phase after identity is preparing. So you prepare several things. I'll just make it a bit bigger for you to look at it. So in preparation, so so in preparation, you're in, sorry. Where were we? Yeah. So yeah, in the preparation, you're updating different kinds of procedures. You're inviting patients for their appointments. So your preparations should be all geared towards this care planning, determining some lab work, lab tests that are needed in advance of booking the appointment, and coordinating with the patient to complete pre-working. So you're making the plan, but before that, you're planning on all of these aspects. And then you're writing who's responsible also for it. Then you're planning, reviewing medical summaries, you're gathering social history. So this is all together with the patient. You're discussing and collaborating, prioritizing goals and actions. Your action planning with action, your action plan will start with the patient. You're proactively planning for addressing barriers that could be there. This is all because when you're preparing, you would have some barriers that would emerge. Plan for follow-up with the patient, follow up with the and then you actually have that follow-up in your management. And then you coordinate your follow-up amongst the team. This is for communicating what you've done, and coordinate sharing of care plans with external care providers. So here you're describing how to ensure that the individual is involved in all stages of plan. So you've made that individual sure, you made sure that they're there. But how do you ensure that they are a part of the plan? So evidence tells us that when you're supporting patients to be actively involved in their own care plan, treatment and support can improve outcomes. So you'll have to look at if they're actually really involved, and this could yield efficiency savings for the systems. How is this possible? So the law is clear that you must be genuinely involved in planning your care and support. This means that you are a person who best knows what your needs are. This is for the person who's requiring the care. You should play an active role in planning your care and support. So the process is described as person-led or person-centered. We've talked about it earlier in detail. So the plan belongs to the person themselves, and the planning process should be built around their wishes and feelings and their needs, values and aspirations. The law says that the local authority must take all responsibilities or responsible steps that are required to reach an agreement with themselves and the person who is responsible to provide their needs. So their care and support plan should set out what they need or what their needs are, how their needs will be met, and how the plan will help them achieve their needs and wishes. Sometimes someone from the local authority will work with them to prepare this. Will my care and support plan be reviewed? Yes. They could have a question from you so that there could be a change over time if that care plan did not work. So it would be discussed and then changes could be made. So reviews of their care and support plan should not be used as a way to make cuts to services provided to themselves. So it should be in addition to them, not excluding anything else. So the purpose of reviewing the plan is to monitor progress and changes. So if that's a wheelchair requirement, for instance, and it did not work, so you're not excluding that wheelchair from the next care plan. You're just altering maybe the wheelchair that you provided was not supporting enough. I'm giving Dylan's example. Consider how the care and support plan is meeting their needs and allowing them to achieve their personal outcomes. They can have several outcomes, which is again according to them. Keep their plans up to date and determine what, if any, services might be needed in future. So the care and support plan should be reviewed every 12 months from when it was first implemented. So how is the review carried out? It's a self-review sometimes. So it is when the person themselves reviews their own care plan and support plan and submits it to the local authority for them to sign off. So this is generally only appropriate if they have a stable, long-standing support package with fixed or long-term outcomes. It's peer-led, so it includes a group of friends or family helping them to review their plan. Review from a distance, so this could be from a phone call or online. Face-to-face reviews would be there. So your social worker will be sitting with that person and going through their plan. The local authority, they must involve the person in carrying out the review. They should also involve the carers that are involved, their families if they wish, and anyone else that they request. They might have their partners, they might have anyone else that they would want. And if they have any difficulty involving themselves in the review process, then these other alternatives can be used. So there's an example of case of M. So it's a 67-year-old woman. She has had mild mental health problems, lacked capacity to decide where to live, had substantial medical needs, and including diabetes, which was not well controlled. M was placed in a care home by the Clinical Commissioning Group, CCG, and it's considered to be in her best interest because of significant risks to health if she returned home. M, however, hated living in that care home. She would take her own life, she said. While acknowledging these risks, the Court of Protection said that if M remained in the care home, she was entitled to ask, what for? The right of life and the state's obligation to protect is not absolute, and the court must have regard to the person's own assessment of their quality of life. So in M's case, there was little to be said for a solution that attempted to preserve her life without meaning or happiness. So that's really sad. So when you involve someone in the cycle of care and support planning, these have been mentioned already, this cycle. So it's the involvement is not an isolated activity. It should be an ongoing activity. So it enables decisions to be altered over time to reflect the person's changing needs. Like M, initially she might have liked it there, but now she doesn't want it there because her she didn't have mental capacity to decide where she wants to live. But now that she's been there, she doesn't want to live there anymore. So there should be ongoing communication between commissioners, providers, users, and their families and carers to take right decisions at the right time without giving further room for more adverse effects to impact the person who's under the care. So services must make sure that their staff have the knowledge and the skills to maximize involvement. This is a part of an ongoing conversation that will take place at all the stages of care and support planning process. So like, for example, at the outset, when developing the plan of care to each person, you should be discussing what the care plan would be, maximize their involvement. As part of the risk management process, including safeguarding, you should also include them in that. Each and every time care and support are provided, they should be a part of the conversation when carrying out reviews also, and through regular feedback about the people's experience of the services that they receive. M1, 5M1, so it's analyzing ways to overcome barriers to implementing care plans. One of the last topics that we'll be discussing. So advanced care planning is very important. It's called ACP. So these are done when obviously you've seen all what barriers could exist. So these could be staff's lack of skills in managing advanced directives, certain beliefs or prejudices, previous negative experiences from that person's own lives. All these issues would hinder the participation of patients in their decisions. So they might not want to make these decisions based on their previous experiences. So you think, you talk, you record, you discuss, and you share. This is what advanced care planning is about. So thinking about the future, what is important to them, what do they want to happen or not want to happen if they become unwell. Talking with family and friends is very important. And power of attorneys, they could be spoken about. Your wills could be spoken about. And recording their own thoughts as their own care planning, including a spokesperson, and storing this safely. Discussing their plans with their doctors or whoever's caring for them. Discussion and resuscitation plans should be discussed. Sharing this information with others who need to know about it is very important after recording this properly. How to overcome these barriers in care planning? So improving diversity is one very important way. So among the healthcare workforce, this will increase the opportunities for patients to receive care from people who have the same racial or ethnic background. It makes them, research has shown that it makes them feel more comfortable. In addition, there was a study that found that patients are more likely to give maximum patient rating score and were more compliant with the treatment regime when they identified with their provider's ethnicity. So it's always good to have a diverse set of people working. Embracing innovation. So it's very important to prepare a care plan. So the healthcare industry needs to think outside the box when you're providing care. Patient-centered care is increasingly delivered in teams within the healthcare systems and through referral relationships within other organizations. Lots of work goes behind the scenes, and it's not often reimbursable. Developing an innovative system rewards collaboration and will help undo a payment system that does not adequately compensate for his work. Collaborating with community organizations, it's very well said that it takes a village to raise a child. This is for embracing patient-centered care. So hospitals think that they are be-all, end-all of the patient's cares, but actually there are many people and organizations that are also responsible for the person's health. This includes schools, food banks, local agencies, etc. So hospitals, they should change their focus and collaborate with other organizations, serve the whole patient, just not their disease. Serve the whole patient as a person, as a human being. Transforming the culture of an organization to deliver care in a way that is better, that better serves the whole patient. It's a complex endeavor. So you put the patient's needs first. That is very important. And there should be a commitment within the organization to permit staff to address patient needs whenever they arise. And this will require hospitals to invest in training their staff and creating a culture which focuses on customer service, respect, and patient empowerment. Rethinking compliance. Healthcare providers can talk about this a lot. So regulations meant to ensure that patients receive quality care. So it's an incentive to provide care to the lowest common denominator, to provide agencies off their back. So there is something for healthcare leaders to ponder when you have the Amazon CEO Jeff Bezos's statement to stakeholders in 2016. So according to that person, to this person, good process serves you so that you can serve customers. But if you're not watchful, the process can become the thing. This can happen very easily in large organizations. So the process becomes the proxy for the result you want. Stop looking at outcomes and just make sure that you're doing the process right. That shouldn't be the thing. So that thing doesn't have the patient-centered objective there. So that is why it doesn't work. So critically reviewing the challenges of developing care plans that meet the needs of the individuals and their agreed outcomes. There are plenty of factors that you could consider in the care planning that could be poor or not fitting it in the purpose. First reason is that you chose in your that those in your care plan don't have any involvement, so there's no clear communication, there's no inclusive information sharing. That should be there. Next biggest problem is that the care plans are too complex. They can't understand, so it's beyond their understanding. Real big problem is that they contain sarcasm, rude or offensive terminologies. That should never be the case, especially for the people with disabilities. There's this overview of care planning challenges that I would want you to go through. If this presentation is not shared with you, just take a picture of this at this time. So we'll talk about this a bit. So you'll be reviewing this when you're off from this lecture. And then I would want you to discuss, each one of you would discuss these pointers. So I hope you've taken a picture of this. Otherwise, I'll share this with you on the WhatsApp group. So these are all the references. There's further reading also. So I'll end my presentation just at this picture, so you can have a good look at the overview of care planning challenges. Any questions? I'm happy to take them.
I want to ask, is there a way one can get a sample of a care plan, like a template, if one wants to prepare it?
Okay, we can provide that for you. I can ask them, and then
Please, I don't mind. I don't mind.
So
Then
if,
also, this module has still not been open in the learning portal.
okay. Could you just email these two points and at UK Versity? I'll just share that email with you. Just email this so that it's taken as a priority, because I'm afraid there's no one right now at the moment to, I probably there might not be anyone available because it's a weekend, but I can always ask them otherwise.
Okay, I'll send you an email later in the day.
Okay, okay. Thank you so much for your
Hello.
time. Any other questions?
Yeah. The question is that what I see on the Moodle is different with what you are teaching us. Another one, what I saw on the Moodle, are we still going to, is there another person that are going to take that course? Because I know what you are teaching us is different with what is on the Moodle.
Okay, I'm not sure. I haven't had a look at it, but yeah, this is what has been, this is what was, because I have been teaching you since the very beginning. This is what the unit is that I'm teaching you.
Okay.
And yeah, and this is the 5th learning objective, and then we'll have the 6th learning objective, which will be the last objective. And if you have a concern, please email again on this link, if that's okay.
Oh.
I'll share this link with you because I'm not sure what you're seeing on Moodle.
Yeah. Okay, on this link.
Yes.
Only-
So if you have any queries, yeah. Any
learner work at UK Versity. Okay.
yes.
All right.
Is that okay? Any
Yes.
other question?
I've gone on the model, and the model only shows Unit 1, all like the recordings, the assignment brief, the assignment discussion, and for the Unit 1 and Unit 3, there is nothing for Unit 4. So
Just email Farah, if that's okay. Did you get a call?
yeah, I spoke to
Okay.
them. I understand what I need to do now.
That's fine. That's great. Just email them for this also. Any other concerns that you have, just email them, please. They're the ones who are handling Moodle, actually. Okay.
Yeah,
That's it
that's
from
okay.
my side. Thank you so much. Any other questions, please email, and we're happy to take them. You take good care, and we'll meet tomorrow, same time.
Okay.
Take care. Thank you so much for attending the class. Take care of
Thank you.
yourself. Bye. Bye.
Bye.